Welcome to this narrated PowerPoint presentation on quality improvement for nursing students. Hi, my name is Pat Clay. I have a master's in nursing. I am an RN. I hold a pediatric nursing certification, and I am a certified wound ostomy nurse. I was a clinical instructor for nursing students for about 10 years. I hope you enjoy this presentation. Ooh, quality improvement. Yikes. Just the term quality improvement can be intimidating to the nursing student. Nursing students must realize that everyone has the ability and the responsibility for improving the quality of care patients receive. Quality improvement projects can extend to the staff on a nursing unit or, on a more personal level, to home life. Here is a simple definition for quality improvement for nursing. Improving the quality of nursing care to achieve defined outcomes through defined processes that minimize risk and maximize benefit. Where do we start? Well, quality improvement starts with the idea that there is a problem, and you can't solve a problem that you can't identify. Identify a problem. Here's a couple of examples. 3 patients today have not had a bath since admission. My budget is ruined from eating out a lot or buying takeout. When people say what they don't want, ask, what do you want? Thinking about our 2 problems, let's say what we want to have happen. I think every patient should have a bath within 24 hours of admission and daily thereafter. I want to have healthy food at home so we don't eat out so much. What we want to see happen becomes the outcome measure, the outcome or result we want to measure up to. An outcome measure is what you track to see if you're hitting the mark. This will require data collection. To measure progress toward the outcome, we will need to do some data collection, or see how many people get their bath within 24 hours of admission and a daily bath. Data collection is written down or entered into a data collection tool. This might be paper pencil tool or electronic. Data are usually collected over a specific time frame and then analyzed. Okay, so here are some specifics about our data collection. As I said, we will be looking at patient baths. We will be collecting data retroactively, that is after the fact, by looking at the charts or doing a chart review. Here's an example. We will look at patients admitted on June 1st, 2020 through July 31st, 2020. That's our time frame. Let's look at our outcomes data. Total patients whose medical records were reviewed was 127. That number is the denominator or the bottom number of our fraction. And as you see here, we had 47 patients that did receive a bath within 24 hours of admission and 80 that did not. And 71 received a daily bath and 56 did not. Total patients that received bath within 24 hours of admission and total number of patients that received a daily bath will be the numerator or the top number of our fraction. So in the analysis of our outcome data, 37% of patients admitted to the unit from June 1st through July 31st received a bath within 24 hours of admission to the unit. 56% of patients on the unit received a daily bath. Let's talk about a critical part of quality improvement, process measures. Outcome measures are what you want to happen. Process measures are how you want them to happen. One of the best ways to show how to accomplish an outcome is by using a flow chart. There's basic symbols that you use in a flow chart. The oval or circle is the start or stop. Then we have an arrow that is showing the flow of the process. And then this rectangle or square shows a step in the process. A diamond is where you have to make a decision, yes or no. And then, of course, we have another step that the no leads to here. And then we have a stop, the end of the process. An excellent tool for identifying process measures is the flowchart. A flowchart is a picture of the steps of a process from start to finish. It can help pinpoint problem areas that, if addressed, can improve outcomes. Here we created a flowchart of the patient bath project. We started with the two types of patients, those that are newly admitted that should have a bath within 24 hours, and those that have been on the unit that should have a daily bath. On the newly admitted patients, we ask, are they clean? Yes, no. Are they ambulatory? If they are not clean, then we look at some other steps in the process. Do they need a bed bath? Are they a patient that's been on the unit daily? How do we communicate that they need a bath and when they are going to get a bath? And then we have a arrow here that actually doubles back. So I remind the CA, but it becomes a loop. Was the bath completed? No. Was the bath completed? No. Was the bath completed? Yes. And then we have the end point. Let's talk about process flow data collection. We saw that outcome data was pretty straightforward. In our project, we collected outcome data from the patient charts. Process data collection requires examination of the process or the steps in the process. We'll ask the staff questions. Looking at the process and hearing from others who are involved in the process helps to identify areas for improvement. There are several steps in our bath project to make sure a patient gets a bath within 24 hours of admission and gets a daily bath. Here we see that we have asked a new patient if they're clean, and yes, or the patient that's been on the unit. So we have a circle here that we need to just schedule a bath and then write the time on a board in their room. Now, for the newly admitted patient, if they are not clean, we need to look and ask them if they are able to walk around or stand. Are they ambulatory? And if they aren't, then they get a bed bath. And then if they are ambulatory, we might put them in the shower or set them up for their own bath. And we say, have you gathered the supplies? Is there a problem there getting the supplies? And then, was the bath actually documented? Remember that if it's not documented, it wasn't done. Okay, let's look at our process now. The team got together and decided that we wanted to concentrate on the patients receiving a daily bath first. The outcome data showed that only 56% of patients received a daily bath. We wanted to raise that number to 75%. But how? What in the process would keep us from reaching that goal? Well, we wanted to look at the first step of scheduling the bath and getting that time written on the board in the patient's room. Here is what we decided to do. We went to each room to make sure there was a board in every room and markers at the board to write the bath schedule down. At the staff meeting, we were able to share the project and remind everyone to share with the patient the importance of a daily bath and to work with them on when that bath would be done. We asked the care assistants to make sure there were bathing supplies available for every patient in their rooms. Let's talk a little bit about the quality improvement cycle. We want to check if the actions we took increased our percentage of patients receiving a daily bath. Again, we will collect data for 2 more months after our actions are implemented. This step is ongoing in the cycle of quality improvement. So, in summary, identify a problem and set a goal for improvement. plan the steps to reach that goal, take action to implement the steps, collect data before the project implementation and then after implementation of the steps thought to improve the outcomes, and repeat the cycle until the goal is reached. Providing quality care is no accident. It's a lot of hard work and requires a team. Giving our patients our best is what we do. Now it's your turn. How can I eat healthier meals with my family on a strict budget while I'm in nursing school? We're going to set some outcomes. I'll stay within my food budget of $200 a week for my family of 4. And we will eat at least 5 fruits and vegetables per day. I'm going to flowchart the process. Let's look at how we do meal and snack planning. Let's look at how we prep food. And let's look at meal times. We're going to collect the data to show the goals were met. Here is one way that's fun for the kids. You have a My Plate from myplate.gov, and they can put a sticker on each part of that plate throughout the day. If they've eaten a fruit, they put a sticker on fruit. If a vegetable, on vegetable, and hopefully there's 5 fruits and vegetables combination a day, and then a grain and a protein and a dairy. So that would be a fun way to collect your data. Data collection tools don't have to be boring. Here's another resource. There are specific aspects of patient care that are nurse sensitive or that depend on nursing for the outcomes. The Agency for Healthcare Research and Quality has a list of these nurse-sensitive indicators, and it's a great resource for learning about quality improvement. You can find the HRQ website here, and here's a picture of what their website looks like. Thanks for watching. Find more narrated PowerPoints for nursing students and others on my YouTube channel at Prof. Clay A+ Clinicals. Or you can email me at profclay2020@gmail.com.